Chapter 21, Part 2. Methods of sterilization. Destroys all microbial forms, including bacterial spores. Absolute turn. Cannot be partially sterile. All reusable items that come in contact with the patient's blood, saliva, or mucous membranes must be heat sterilized. The three most common forms of heat sterilization in the dental office are steam, chemical vapor, and dry heat. Steam autoclave. Sterilization by steam under pressure. There are 4 cycles: heat up, sterilizing, depressurization, and drying. The heat, not the pressure, kills the microorganisms. Flash sterilization. For sterilizing unpacked instruments for immediate use. Instruments are no longer sterile as soon as they are removed. Best practice is to use a different method that involves wrapping. Unsaturated chemical vapor sterilization. Similar to autoclaving, except that a combination of chemicals is used instead of water to create a vapor for sterilization. OSHA requires a safety data sheet on the chemical vapor solution because of the chemical's toxicity. Advantages of unsaturated chemical vapor sterilization: does not rust, dull, or corrode dry metal instruments. Low water content of the vapor prevents destruction of items such as endodontic files, orthodontic pliers, wires, bands, and burrs. A wide range of items can be sterilized routinely without damage. Short cycle time, availability of dry instrument after the cycle. Disadvantages include requires adequate ventilation. Vapors can temporarily leave an unpleasant odor in the area that may be irritating to the eyes. Filtration and monitoring of chemical vapors. Special filtration devices in newer sterilizers reduce the amount of chemical vapor remaining in the chamber at the end of the cycle. Formaldehyde monitoring badges, similar to radiation monitoring devices, are available for employees. Packaging for unsaturated chemical vapor sterilization. Standard packaging for chemical vapor sterilization includes film pouches or paper bags, nylon see-through tubing, sterilization wrap, and wrap cassettes. Pressure, temperature, and time. 3 major factors in chemical vapor sterilization are pressure, temperature, which should measure 131 degrees Celsius, and time, which should measure 20 to 40 minutes. Dry heat sterilization. Heats air and transfers the heat from the air to the instruments. Requires higher temperature than steam or chemical vapor sterilization. Dry heat sterilizers operate at approximately 160 degrees Celsius, depending on the type of sterilizer. Advantage of dry heat: instruments will not rust if they are thoroughly dry before being placed in the sterilizer. 2 types include static air and forced air. Ethylene oxide sterilization. Advantage: low temperature won't melt plastic or rubber. Disadvantages include requires 4 to 12 hours depending on the sterilizer model. Requires at least 16 hours of post-sterilization aeration to remove the gas molecules bound to the plastic and rubber surfaces. Ineffective on wet items, and toxic if gas is not handled properly. Liquid chemical sterilants. Useful for some type of plastics, such as rubber dam frames, shade guides, and X-ray film holding devices. A liquid sterilant, such as 2 to 3.4% glutathaldehyde, must be used for sterilization by those items. And be sure you have a SDS for these products. Sterilization failures. When direct contact for the correct time between sterilizing agent and all surfaces of the items being processed is insignificant. Improper instrument cleaning, packaging, and sterilizer malfunction. Sterilization monitoring. Proper sterilization is crucial. 3 forms of sterilization monitoring include physical, using gauges and readings on the sterilizer to record temperature, pressure, and exposure time. Chemical, heat-sensitive chemical that changes color under certain circumstances. And biologic, including spore testing. Chemical monitoring. Process indicators are outside the instrument package. Single parameter indicators can only identify the temperature exposure, not duration or pressure. And process integrators inside the instrument packages, multi-parameter indicators, combination of pressure, temperature, and time. Spore testing is the only way to determine whether sterilization has occurred and all bacteria and endospores have been killed. The CDC, American Dental Association, and Office of Safety and Asepsis Procedures Research Foundation recommended at least weekly biologic testing of the sterilization equipment. High-speed dental handpieces rotate at speeds of 400,000 revolutions per minute. Blood, saliva, and tooth fragments, as well as restorative material, may lodge in the head of the handpiece, where they may be retained and transferred to another patient. Dental handpieces must be properly cleaned and heat sterilized. Flushing the handpiece is the best way to remove debris from the head. To flush a dental handpiece, attach a pressurized handpiece cleaner to the intake tube of the handpiece, where the air passes through, and flush the head of the handpiece to remove debris. Blow out the handpiece using compressed air to remove debris before sterilization. Only steam sterilization and chemical vapor sterilizers are recommended because sterilization temperatures should not exceed 275 degrees Fahrenheit. Handpieces should be packaged in bags, wraps, or packs to protect them from contamination before use. Never run a handpiece hot out of the sterilizer, and avoid rapid cool down, such as running the handpiece under cold water. If handpieces need to be cooled quickly after sterilization, use an air fan to blow room temperature air over them.